I'm Sarah De Cicco, and I'm an OBGYN here at Olmsted Medical Center. So I do full spectrum obstetrics and gynecology, meaning we do everything from prenatal care, labor and delivery and birth, postpartum care, gynecology problems such as endometriosis, abnormal uterine bleeding, pelvic pain. Of the things that I'm probably more interested in or specialize in a little bit more than my colleagues are probably chronic pelvic pain, disorders of the vulva such as vulvitis or irritations like in sclerosis, those kinds of things. And to some extent in more integrative medicine and holistic medicine. The real reason, if I trace it back to the very initial thing that I became an OBGYN, is I took a women's studies class in my senior year of college, and we read the sort of parts of the textbook called Our Bodies, Ourselves. And it was started kind of in the beginnings of the feminist movement in the 70s. And it's essentially a textbook of like women being able to understand their own body. And I found the whole concept of it fascinating, reading parts of it fascinating, things that I didn't know, and just kind of sparked my interest from there. Probably the best and most rewarding thing is when you're able to help someone through a time, whether it's a gynecology issue or their birth that is difficult, that would have been harder for them if you weren't there. That's probably the most rewarding thing that we do. Is sometimes that's a birth and sometimes it's not a birth. Sometimes it's that they've never been able to have a comfortable exam and their exam was fine. And that's extremely rewarding. I guess the number one sort of misconception that I think people should know is that nothing ever should happen in your appointment that you don't want to have happen. So if you don't want to have a pelvic exam, you don't have to have one. You don't want to have a pap smear, you don't have to have one today. We'll always talk about it, but there's nothing that ever happens in your gynecology visit that you don't say yes to. And so you have control over the time and you have control over what you're going to do that day. It's important for me to make a connection with my patients because not only is it important for them to understand that they can trust me and that we're on the same page about what they're going to do, but because that's part of what brings me joy in my job, is feeling like I have helped them and that they felt helped. If I help someone and they don't feel like they got anything out of it, it's not as real for me or for them. I have toddlers, so that's a hobby. I do a lot of reading. I try and play with my kids as much as I have energy for. I cook when I feel like it. We spend a lot of time with our extended family too. I'm from Rochester, so our extended family is all pretty close by, including my grandma, who's turning 90, that we see at least every other week or so. So we spend a lot of time with family. A big part of why I like coming here is that I like our patients. I genuinely like our patients. And that is really special. I feel like we have an awesome community, and I feel like I'm being part of that community when I come to work. And the other part is my coworkers. We have a really fantastic team in our department, and you feel like you're really participating in something that's meaningful.